Well, so big picture, broad brushstrokes, because obviously we've got a combination of people here. Um, we, we're born out of a GP practice. That's where we still are. So we're calling you from Stratford Village Surgery. And kind of the origin story, which a couple of you will have heard already, is basically the two people that started our organization, Raj and Pete. Raj's parents run the practice, and they came in during COVID to basically try and work out what they could do to help. Pete has a kind of technical engineering background, and then they started with automating registrations, which we're going to talk about today. Um, so, as we'll go into, kind of really taking a lot of the work off the plate of your admin team who register patients, and they can focus on the many other things that are needed in a practice. We then moved on to do lab report filing, I think because Raj's dad said, great, you've helped the admin team, but can you help the GPs from with all the lab reports that we have to do, which again, we're going to touch on. And then kind of broad brushstrokes for the people who are aware of what we do and are thinking about what else. We have a couple of other things. So we have a new service for trying to attract new patients. And then we literally in the last week have released a new triage tool. I can talk more to those towards the end. I'll kind of focus mainly on, well, I mean, to use your time, Sarah, maybe I'll just give you a 30-second spiel now, and then you can decide whether or not you want to kind of stay on for the whole thing. Basically, we've kind of avoided triage for a while because we didn't. It's a pretty crowded market, but since AI has been introduced, it's become apparent that we can build something especially powerful that basically can do end-to-end triage from taking a targeted history from the patient, understanding the urgency of the issue, and actually making a booking, a provisional booking, kind of all overseen by your team, but like end-to-end triage, which no one else is doing yet. So I won't distract us too much because that's not the intention, but just to give you a flavour. Oh, hi, Bryony.
Oh, hi, sorry, I'm just trying to work out my IT.
Oh, all good, all good. You're the last person for me to put on the spot. So um, I'm very happy to talk more about that, Sarah. But for today, I'll focus on the other two, I think. And then yeah, let me know if any of that sounded interesting. So basically, um, registrations. We basically did thousands of them in the practice. Pete and Raj kind of sat there doing them, and uh, I'm not sure how close you all are to how registrations work. It's kind of pretty. You'll have different levels of proximity to the process. Some of you may have done them before. Some of you will be like, What's a registration?" The way it works is patient sends in their information. It comes into the practice as a PDF, and your team need to find the PDF and copy all the information over to your clinical system. And not just that, but actually code the information. What tends to happen is in some practices, they've got people who are always on it, great. But those people maybe are also doing three other things. So it's taking a lot of their time. They're never able to do like a full, really detailed registration, so they might not be able to code all the data that you would really love. In some practices, um, you'd basically have people who just like turn to the registration shelf, for want of a better word, whenever they have a moment. So you kind of have registrations stacking up, and you're trying to register patients, but it can take, for some practices, days or even weeks if you're kind of depending on how well resourced you are. And we have a few slides, but at a high level, what we do is basically the patient sends their information in, we take the form, we automatically put the information into your clinical system, we do all the coding for you, and there's just one place, our website, where you can see all the registrations that we're doing for you. We do it for a quarter of the country, so 1,600 practices use us already. We're in every ICB in the country. We've won at the GPO Practice Awards the last 2 years in a row. We've won the award for Digital Solutions Provider of the Year. I'm biased, but it's an exceptional service where probably it will vary a little bit between your practices, but we can automate, fully automate about 80% of your registrations. You'll need to do nothing. And then the remaining maybe 15% to take you up to 95%. There might be a minor touch where the admin team just need to check the surname or something really minor, as opposed to them doing the whole process. So you have 95%, which are either fully or totally automated. So near enough taking the whole task off your plate, and doing it to an exceptionally high standard. So hopefully that's making sense so far. I'm actually just going to grab you the slides because obviously it's kind of a lot of information for you to process. Oh, I don't have the ability to show slides. That's fine.
Well, they know you well. Don't give him the right to show any
Don't
slides.
let me show slides. So that's all good. I've done this enough to kind of be able to give you a high level sense of it. And obviously we can send slides, or you've got the slides of me and Rumi talking through it. Like high level benefits are basically, think of the person who's doing your registrations at the moment, or the multiple people. It will vary how long it takes them to do every registration. On average, it takes 15 minutes. So if people kind of feel it takes less, that's likely because the person doing registrations isn't able to register all the information that they kind of would ideally do and all the coding that they would ideally do. Some people it will take longer. So it takes about 15 minutes. We're going to basically take all of that off their plate. Before people automate their registrations, it can take maybe 3 days on average to register a patient. Some of you will already be quicker, so no disrespect, but with us, it will be done in a matter of hours. So the thing never sleeps. It's constantly registering patients. Someone registers their whole family at the weekend. It registers them during the weekend. And then there's this point about not just kind of saving time for your staff, not just benefiting patients in terms of how quickly they register, but also just the sheer amount of information that we can put into your clinical system. So I've kind of reiterated this point a couple of times about your staff are doing so many different things. Some of your staff will be speaking to patients at the front desk at the same time as doing registrations, at the same time as doing either recall or whatever it may be. We will always put all the information into a clinical system, but there's also a big innovation from our side, and you'll all I haven't asked you how long you've been in the NHS, but I'll make the assumption that you've been in long enough to know that there was a time when everyone had their own registration form, right? Yeah, everyone had their own questions they wanted to ask for obvious reasons. Like not every practice is the same. People have different interests about their local population. NHS England moved everyone over to their form, so you'll now all be on the same form. And then that obviously kind of homogenizes things, which is helpful for NHS England, but there are questions that you can't ask anymore. And you might be sending out questions, after people register or when they first come in. But we worked with NHS England to create what's called the local form, where I'm doing a registration, I finish it, great, and then I click the button, which would say submit. And as far as I'm a patient, I have no idea what's happening, but I go to the next page and you're on a new page, which is the page we've created with NHS England, where we're able to ask further questions. And the long and the short of it is, for you as a practice, you can decide to ask a variety of additional questions you might want to know about your patients and get that information at the point of registration. So it could be things like pregnancy status, are they registered with maternity services, sexual orientation, blood pressure if they know it. Like practice managers often talk about it as a kind of almost a light kind of health check when a patient's first joining. So you can add a lot more information to your registration form and get that straight away.
One of the examples I like to give, if I
Yeah,
can
of
jump
course,
in
please
just
do.
quickly. Hi folks, I'm Rumi. So I think in the main form, you've got questions like, do you smoke, right? And in the second form, the local form, Healthtech one's exclusive form, we can then ask, would you like smoking advice? And that's aligned with your QOF indicator, right? So straight away, you're getting that code added to that patient's record and you get the QOF tick done. If a patient said no to that smoking question in the first form, they're not even going to see it in the second form about smoking cessation because it's not appropriate for them, it's not relevant. We don't want patients getting loads of fatigue from questions that don't make sense for them. Same as, if a patient was assigned male at birth, they won't see the pregnancy, IUD, those questions because it's not relevant to them. So it's really smart. And the main thing is that you control it. So whatever's important for you to ask your patients, you include, and if it's not, you keep it unticked. And you can change your mind. So if you wanted to go into settings after you've already automated for months and you think actually this question is really important. The other really cool thing is if there's a question that doesn't exist there, let us know. There's actually a list of questions that practices have sort of requested, and you can upvote each other's ones. So whatever is being asked for the most, we can actually just add that in. If there's a particular flag that you need for a particular care home that you work with, we can make sure that that's always flagged to you. So there's lots of ways to really cater and configure so it matches what your practice needs.
And should we answer Nikki's question right now?
Yeah.
So about assigning new patients to a specific GP.
Yeah, so I guess it depends, right? So if you could tell us a tiny bit, Nikki, about how do you decide? Is it a rota, 1 week it's one GP, 1 week it's another?
Yes, but it also depends on how many sessions they do. So obviously our 7-session GPs have larger patient lists than our 3-session GPs.
Yeah.
So yeah, we tend to give 10 to that doctor, then the next 10 to that doctor. But we also have to factor in families
Yeah, absolutely.
and things like that. So yeah, I'm just wondering how would that work with your
Really good
system?
question. So what we do is we've designed a GP round robin. So really, we've taken into regard essentially what you've just said, right? So if you've got a clinician who does, let's say, twice as many clinics as another, you want them to have twice the share of new patients. So in our system, you tell the system that you say, Doctor 1, they get 1 share of new patients, Doctor 2 gets 2 shares, Doctor 3 gets, and you can change that again at any point, and our system will know. If there's a child being registered, we'll always register them with the same GP as the personal parental responsibility. What we don't do is household matching because not all adults necessarily want to be linked, so we don't do that. But we do, for child registrations. And I think that round robin is really helpful, right? Because you don't have to then go into the system and change every week. And if you have a new clinician come in, if you want, you just set them as the only usual GP for a while, right? Until their list builds up. So it's again configurable and catered to match how you need it. If we could share screen, I'd love to actually just show you Hub. I feel like we've got a couple of people on the call who already automate with us. So Ben and Sarah, I think you're both your practices already automating registers with us. But I hope that it's really easy in Hub to make all of these changes. But maybe Ben, you unmuted for a sec. Could you maybe speak to that a little bit on the configurability and how if there's anything we can make better as well?
Hello.
Yeah.
Yeah, I think so registrations wise, I think we were right at the beginning, start of pilot. So it was really basic at the beginning, but over, I'd probably say 8 to 10 months in, there were lots of lots of improvements made back end. Very, very configurable. You can opt in and opt out of lots of, there's reviews. So you can select options. Say, for example, if somebody's in a care home, it will flag up and then it will sit in a workflow for you to review. Those that maybe are in care. There's lots, I think there's 50, is there 50 points, I think, going by memory? So 50 options that you can select that flag up. So it's all automated in the background, and then it will send you an email. So you can configure once somebody's registered, an email will pop in, and you can log into the hub, and it will give you lots of different metrics. I'm happy. You've probably got screenshots anyway that you can send to everybody. But yeah, it's really, really helpful. And like I said, it takes away the admin burden from the team.
Thanks, Ben. I'll send you a tenner later.
We've just received something from Healthtech, actually. We've received some. Have you got it? Yeah, you're probably expecting us to have it, but yeah. Thank you very much.
Oh, you're welcome. You're so welcome.
Oh no, I'm going to make Ben feel unspecial, but you are special, but we have sent something to each practice as well.
Yeah, I did notice that.
We always get told by practice managers, right, that you all don't really get the gifts and the thank yous, and it's a very thankless job. You've got it from all angles and you deal with so much, and we just want to make sure that you get a little bit of a gratitude and hopefully feel a little bit special. So if you haven't already, watch out in the post. Should we share screen and jump into just show a couple of these slides? I think speaking to them. Nice.
Where would you like to go?
I'd like to talk about signals very quickly, because
Yeah,
that one we haven't
cool.
actually mentioned. So I think this is what Ben was just alluding to now. So as well as you take all the patient information, right? The way that our system works, we match everything to we match about 15 data points to the spine. So we're absolutely certain we've found the right patient. We'll then add all of the information, date of birth, first name, surname, email, da 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 da, and any codes. But of course, until the GP to GP record comes through, there's a lot of data that won't or already be there. But there might be a first step or like a proactive step that your team want to take for the patient's care. So we flag these up almost like a highlighter pen on your registration form, and we call it a signal. And similar to the local form questions, you get to configure which signals you care about. So one of the things that Ben just mentioned, care home patients, maybe your team would like to know each time a particular registration is for a care home patient. So maybe there's a flag that they'll add, or you might want us to assign a particular GP for all of your care home residents, this kind of thing. Another flag might be stated repeat meds, right? So if the patient's record says that they're stated repeat meds, rather than waiting for their repeat prescription to be needed and for them to run out of their meds, you can straight away create a task if you want for your pharmacist to book a medication review with that patient. So imagine that patient's just joined your practice and straight away you're taking a proactive step to take care of them. You can have every signal off if you wanted, though. It's not a must-have. These are the nice to haves. So these are the workflow where you review the registrations that have already been done, but if there's a step you want to take. So yeah, the signals I think is a nice way to give that patient a really 5-star service as soon as they join your practice. I think Ollie already sort of covered the proportion of work we can take away.
Yeah, I guess this is just giving you a bit of an insight into the actual user interface. So we try and make it all kind of much more joyful to do registrations instead of kind of digging around in a PDF. Your admin team will be able to see all of this in a really clear way. Obviously, we'll be automating it, but we show them things like, we've just automated this registration. You might want to know they have repeat medications. And a thing that we often don't kind of blow our trumpet enough about is the analytics that we're also able to show you. So we can show you the volume of your registrations, but we can also show you demographic information. Who are your patients? Sometimes practices really want to understand that more thoroughly, and it can inform like how you run the rest of your practice sometimes.
Yeah, one nice thing a practice brought up with me a little while ago was they really find the interpreter language quite helpful. They spotted that there was a particular language that was popping up a lot more towards the end of last year, and it must have been that there's a new community or that whether it was refugees, asylum seekers, immigrants, there's a group that were in the area. So next time they were hiring someone on reception, they put on their ad preferred language. So straight away you're kind of catering for the changes in your community. And this is a bit of a laundry list, but just to sort of really double down on how configurable and customizable things are. So if any of you have branch sites, we're able to configure those depending on whether you operate from the same clinical system, etc. Care home university patients will do the RI coding. If you accept out of area patients, there's a very different welcome message that goes to out of area patients. So rather than the usual hi, welcome to aerial healthcare, it would be hi, you're registering as an out of area patient. You won't receive home visits and you'll get a limited set of services. So straight away they know where it is that they sit, and a few other things that I think we've already covered there.
Yeah, I think that probably does justice to registrations, doesn't it?
Any questions on it? I
Yeah.
think we've done quite a bit of the talking.
Yeah, let's pause before we move on to labs and get some thoughts. Nikki, go for it.
So after this fabulous 6-month free trial that is
Yeah.
being offered, how much does this cost? And is it charged per registration completed, or is there an overall cost as well?
Yeah, really good question.
Outrageous that you would ask about cost.
Sorry.
So yeah, the way as you say, everything we're going to talk about today is free for 6 months, and then sorry, Lorraine, do you want to drop your question in quickly, and in case it relates to the same thing, or is it separate?
No, it doesn't relate. It's separate.
Okay, cool. Let's do pricing then. So the way we think about registrations is that at the moment, probably takes about 15 minutes for each registration. I would like the slide to be focus on the left-hand side. There's kind of a lot of information. The left-hand side is what you do at the moment. So it takes about 15 minutes for each registration. When you think about the people doing your registration, obviously it varies, but their time, when you include their on cost, we think about £16. So if they're doing 4 every hour, it's about £4 per registration is our estimation. We think it's also modest because it doesn't take into account things like staff sickness or when rejections occur or training people when someone leaves another person. Anyway, let's take £4 as an approximation. With us, it's £2.50 plus VAT, but it's. I would be very quick to say it's not going to be that for you because we're basically going to run it in a way where the more people in the ICB that use it, the cheaper it gets. So I'll go to that in a second, but in brief, you do pay per registration. There is absolutely no contract tying you in, so you use it for as long as it's helpful. The moment it's not, you stop. A vanishingly small number of people stop. That's kind of why we have the confidence in doing it. Any text messaging is included, and we basically support you with all of this. There are kind of some common principles in how we operate. We support you in setting it up. We support you in training your staff. And then I'm kind of going to give the game away on the labs price. So maybe we'll come to the end, but let's do it now.
So go for
Let's
it.
just do it.
Bit of spoiler alert. Why not?
So if everyone in the ICB is using registrations, then it's 175, not 250. And I won't go into kind of the exact situation, but basically the more people who use it, the cheaper it will get. I know that like we don't want to commit at all GPSU funding it because they will have to work that out. So it's worth saying that this may be practice funding it. But we've done this quite a few different times in Surrey, in your neighbourhood, in just north of you in the Bristol area. And yeah, a very high proportion of people roll off from trying it to continuing to use it. So that's pricing. Does that make sense, Nikki? Cool. Lorraine, do you want to ask your question?
Yes, thank you. You mentioned that the registrations take place over the weekend, for example, which would be very welcome. Is there any functionality that allows you to stop it from registering people who are outside of your area? This is quite a complicated rural bit of Somerset, and there are some places that are very close to us, but actually technically are not within our area.
Yeah, Rooms, do you mind answering?
Yeah, absolutely. Yeah, so we call it a pass over. So we can pass over a registration and not automate it, and we'll leave it in your workflow patients to review folder, basically. So out of area is one example. Another is, for example, anyone on your naughty list. So if you've had patients that you've removed in the past, you can tell the system their details, and our system will block it from being automated, and will always flag up on that registration form within Healthtech One Hub the reason why we haven't automated it. So it will say, this patient's been removed in the past. Do you wish to forgive them? This patient is registering out of area. Another example would be this child registration, and we couldn't find the personal parental responsibility on your clinical system. Those are like some of the reasons why we wouldn't automate it the first time. There's never any guesswork in our system. It's very much structured to make the decision as we've told it to. And if it ever gets confused, it falls over and we go and pick it up. But yeah, it is very nice. We get great feedback that people are pretty happy that we don't give the system Christmas off or weekends or evenings. It gets nothing. It works and works.
Okay, that sounds good. Thank you very much.
No, of course. Any other questions on registrations? Otherwise, we'll jump into lab report filing.
Yeah, maybe I will. Bryony, sorry to put you on the spot, but you obviously represent a large number of practices, and it sounds like you're generally interested in the pilot. But we'll come to everyone, but I particularly would love to hear your thoughts, given that you are speaking for quite a few practices.
Yeah, definitely. I mean, we've already looked with registrations with yourself. We'd already had a business case ready to go, so we're definitely wanting to sign up all practices for registrations. I'm particularly interested in sort of your demo now on the lab filing. We have got a current pilot underway with a different provider at the minute for automated lab filing. So some of our practices is with JeffJab. But so this, if we were to put the other practices in, it wouldn't include all of them, just on that one, but registrations would be. So yeah, interested now in the labs.
Nice. How many practices are piloting JeffJab?
3, but they are 3 of our largest sites.
Got it. Cool. Okay. Right. No pressure then. Onto the labs demo. Right. Let's get the slides back up. Rumi is definitely the authority on this one. So.
Wow. No pressure.
No pressure to you, Rumi.
Yeah. Excellent.
Yeah. Cool. So yeah, our second service, lab reports.
Nice one, mate. So I think first thing to note is two main principles, safety and simplicity. With the safety, obviously we're going to give you all of the DCB, DPIA, every acronym under the sun. But I think what's really worth noting is we abide by what the path lab puts in the report. So whatever range the pathology lab gives for that particular machine, that's what we use. We're not going around moving the ranges up a bit, down a bit, or anything like that. We take that as the rule. And simplicity wise, we'll show you all of the decision trees for the 36 different protocols that we're able to file for, and you'll be able to see really clearly exactly how the system has made the decision on what to file and what not to file. Now, the way that it works, so I've mentioned the term decision tree. This is a decision tree over here. So this is just a really simple-ish example of vitamin D. I'm going to zoom in on these in a second, so don't worry about looking at it in much detail right now. But the way it works, really similar to registration. So for registrations, we ask you to set up 4 different EMIS users and create higher level admin access. For lab report filing, it's really simple. You give us a medical secretary user in EMIS, you give us global viewer access for lab reports, and our system will then log in every few hours. It will scan your global inbox. Any protocols that you've ticked and said, yes, we're happy for Healthtech 1 to file, we'll pick those ones up, we'll compare it to the decision tree, decide whether it's safe for us to file, and if it is, and if you're happy and you've got text messaging on, we'll then also text the patient to tell them. It's worth saying that we combine text messages. We're not going to send one message for the first result and then second message comes 10 minutes later, send another hour later, another, because often for one patient you'll have multiple results. What we'll do is we'll start a timer for 4 hours. If another result comes in within those 4 hours, we'll reset that timer for 4 hours. Whatever's come in the first 24 hours, we'll bundle into one message and send it as one, so that patients aren't getting fatigue or bombarded.
Mm-hmm.
You can see all the work done again in Healthtech 1 Hub. There'll be a separate section for lab reports. Now, this is a couple of examples of decision trees. The one here is smear tests. So for cervical screening, it's a bit of a monster of a decision tree. Obviously, we'll share all of the decision trees with you after the call so you can deep dive them with your clinicians. But to kind of show you how our system makes decisions, right, we've got different components that we'll look at. And then down here for smears in particular, we'll add diary entries. So any box in green is a diary entry that we've added, and any box in blue is where we've added a code. So this is why we're able to be fully exhaustive. We can take away 100% of your smears filing. If it's your nursing team that does it, then imagine the amount of time that you can unlock. And the other example, I'll just show this one. So vitamin D we often get asked, is it just normals that you file? No, we can file some of the abnormals too. This is why we use the term fileable rather than normal and abnormal, right? So with vitamin D, when a patient's in this insufficient range, it's always the same thing that your clinicians do. They basically send the patient a text saying, go and get over-the-counter vitamin D. Why are your clinicians spending time sending texts? Let our system do that, and then we'll leave any of the deficient where they really do need the team to look at them and hold the patient's hand through that, probably prescription vitamin D, etc. We'll leave those for you.
Mm-hmm.
Okay. Another example would be HbA1c. Newly pre-diabetic patients or anyone in the pre-diabetic range, we can message them and send them the link to the diabetes prevention program, right? So again, taking out the admin from your side of things. With FBC, one of the good ones as well is that we'll look at the trends, not just the absolute result. So let's say a patient's got a normal FBC result, but actually we notice it's dropped significantly since the last one.
Mm.
Even though it's normal, we're going to leave that one and we're going to leave a sticky note for your clinician to see why it is that we left it. It's worth saying we don't auto archive your results, so your team can still see all of the work that's been done. Okay, so you'll be able to see them grayed out. It will be viewed and it will be filed, but your team can still see all of the results for each patient. Worth saying, we auto chase non-responders for the bowel cancer screening program, and we'll add the relevant code to say that we have chased them as well. And then it's worth saying with results where your clinicians don't want us to file it, even if it is normal, there may be an active investigation ongoing for that patient. You can tell the system when you request the bloods that you don't want us to automate it. So you just add #do not automate for that patient's request, and the system will know not to jump into it.
Mm-hmm.
I think I've covered everything there. any questions on that, or would anyone like to sort of jump in on any particular protocols? I guess if you're Bryony, maybe one for you with JIF-JAF, if there's any bugbears that you felt with them, or any particular questions you might have where you want to compare. Now's your time.
Yeah, I think to be able to do that, I think I would need to look in a bit more detail at the decision trees to kind of do that comparison. Obviously, there's a bit more flexibility in the sense of the ranges as part of JIF-JAS process. Whether that's better or worse, I wouldn't like to say. But yeah, so I think what we'll do is I'll take that away and pick up with our sort of deputy medical director, because Kelsey's off following today for a week or so. So yeah, it'll be interesting.
Yeah, if it's helpful, by the way, Bryony, if you want to set up a short Teams chat between us and one, your clinical lead or anything like that, happy to deep dive a bit further once they've taken a look.
Yeah, that would actually be really helpful.
Yeah, cool. No worries. And again, I think, Ben, your practice is already automating lab report filing as well. So any pros, cons, in-betweens that you want to share, please feel free.
We just let it run. So we literally just don't have to worry about it. And actually now our patients are used to it. They know they'll get an automated text if maybe they're a controlled diabetic, or if, well, again, like anything. So if their labs are fine based on the rules that are set, it will tell them that there's nothing to worry about, and then it will give them a short link with some advice if they want to click it. And then if actually it is outside of the range that's not set, then it's then left. It's not filed at all. There's one little thing that I probably need to pick up with outside of this as an improvement. But so yeah, I mean, so far since we've had the labs element, which I think we opted in for very shortly after, again, it was introduced, we've Healthtech have filed just under 33,000 labs for us, which is incredible.
That's great.
So yeah.
Thanks, Ben. Just looking at Nikki, your question, do they show as provisional EMIS so that patients can't see it until a GP has? Tell me a little bit more what you mean by that.
So obviously a lot of patients have online access to everything now. And currently when our lab reports come in, the GPs can see them in EMIS, but they're marked as provisional, which means they're not visible to patients on the NHS app or whatever. So yes, I'm just wondering, if they're filed, do they automatically become visible to patients if they've got that access?
Yeah, exactly. Yeah, then they do. We do find that's a positive.
Just because if they're all normal, that's not an issue. But I'm thinking it says you file 100% of smear. So what if it's an abnormal smear?
Yeah, exactly. So with the abnormal smears, it might be worth. Are you able to bring up the decision trees and let's share the screen on,
of course.
on that, if that's all right.
1 second.
Yeah, no worries, mate. This is great. I love getting Ollie to do the driving. Sit back. But no, within the decision trees, underneath every decision tree, we've got every text message variant, and within that text message, it will basically say, your smear result has shown this. Where I'm not very good at driving the.
What do you want the
decision trees?
The pathways, yeah. Sorry,
thank you, mate. Yeah, so underneath every decision tree, you'll be able to see every text variant, and we'll basically just send that to the patient saying, this is your result, your next recall will be this, or you've been referred to colposcopy, expect a letter, exactly what your team would send. And from the conversations that I've had with nursing teams directly about this, it mimics basically what they would do themselves, but it's basically removing the actual manual part. They still keep track, of course, of the fail-safe list to make sure that anyone that has been sent for a smear has now got their result. But other than that, it seems to work well. It also frees up your phone lines, from what we've been told, because patients aren't needing to, pick up the phone and actually say, what's my result? What's going here?
What about patients that we can't text?
Yeah, really good question. So if there's no phone number, we won't file the result. Yeah, we
Right.
won't file the result because if there is an important piece of clinical information we need to send to them,
Yeah.
then we obviously wouldn't have the means to, so we would leave those. Yeah, it's worth saying, I need to check this with the team, but we've got we're currently in the process of getting the API with NHS app. So the NHS Notify should allow us to actually send it into patients' NHS app as well as the text messaging. So that should unlock more ways to get patients their results. That's the one. Nice. So if I show you, let's stick with smears because that one I think we've, oh yeah, mouse goes backwards, of course. Let's zoom in. So if I open this one up, right, so you've got the actual decision tree here. You can see how each decision is made. If I click on here, you can see it checks the HPV result. It will go, is it negative? Is it unavailable? Is it, oh, she can't move it. Oh my God, I do not like these MacBook things. I want to move this over here, please, so I can show that side. Yeah, that's it. Cool. So then if I come down one of these branches, right, so you've got HPV positive here, and all of the expected types of result that you can have then from the cytology result is down here. So then you've got the HPV, the code that we'll add down here, and the diary entry. So you can see it's 3 months, 12 months, etc., etc., etc. The most common result, right, is your routine recall. It's down here. Now we know that the what's it called? The timelines have changed recently. So regardless of age, it's a 5-year recall if it's routine. Apologies, it's not changed in here yet. So it still says 3 years for the youngest age bracket, but it is 5 years in the system, so you know. So whatever changes happen, we also stay on top of. If we come out of this and scroll down, I just want to show so these are the different text message variants. Okay, so as you would expect, each code has a slightly different result and a slightly different timeline. So we'll make sure that the patient's getting the correct information. Same with the colposcopy referrals. It's the same message we've been told that practices also send. So it's sort of, it's taking away the real manual part of the work, and obviously by helping with not just normals, abnormals as well, you're taking away a lot of the time that your team are typically spending.
So if you send if a patient has got a normal result for say a blood test, and you just send them a text saying your results were normal, forgive me if I haven't seen it or not heard that you said it, but will it say that, you know, if your symptoms persist, get back in touch with us, or is it just saying it's normal, you don't need to do anything else?
Yeah, we don't tend to do like because it's not the same size fits all for all practices wanting that. What we do though is in some of the results it makes sense to say please contact us if you want further support. So but otherwise it tends to be kind of we've given you the answer and that is enough.
To you. Yeah. Okay.
Yeah. I think giving patients that control, right, of their healthcare, I think more autonomy. You get your result, you decide what to do with it next.
Yeah.
Some practices turn texts off, by the way. Some practices still operate in the no news is good news kind of space. There are some exceptions where we would, even though you have texts off, we would still send the text. So for example, HbA1c being in the pre-diabetic range, that's obviously clinically important. So even if you had texts off, would send that one, right? So there's a few that we would still send. But if as a practice you err on the side of no texts, we can absolutely set that for, but it would be across all protocols.
Okay, so one of my GP partners is attending the one on the 1st of September, so I'm sure he will go deeper into this. I'm not clinical, but those are the things I think that they will bring
myself.
up. Thank you.
Thank you, Nikki. Any other questions? I don't know if there's anything else left in the chat that we hadn't covered.
I think we've got it. Nikki was also reminding herself about whether we do anything on document workflow.
You know, document workflow. We get asked this often. We looked into it last year, and we did a project on seeing what it would take, how we would build it. There's so much variation and such high clinical risk that we've stayed away from it for the time being. Like as Ollie sort of mentioned earlier, it's the AI triage space that we've really we feel we're able to have a big impact on. So documents, unfortunately, no, that's not in our forte, at least for the time being.
Nikki, just on that, the GPSU are just kind of scoping further automation tools and potentially putting together a bit of a list of suppliers and stuff. So watch this space.
What do you mean, Sarah? They're not the only ones. What do you mean?
You just said you don't do document
Yeah, fair enough.
or
Fair
recalls. There's
That's
there's a lot out there, but it's
enough.
it's quite hard for practices, isn't it, to kind of know what's out there and obviously
So
and
much.
compare them all. So if we can
have to
try and
listen
help
to what
with
other
that.
people are talking about. Well, I mean, we've just started a trial with Better Letter.
Yeah.
So, but you know, document workflow is our biggest issue. So
Yeah.
that's why I
Okay.
asked.
That's good.
Sarah, go for it.
Hi. Yeah, it might be a silly question. One of the things you did put, you said you could put hashtag do not automate. If you somebody going into investigation. So where do you put that hashtag do not? Is that on the Healthtech system
Yeah.
or
No, is it ICE or Quest, one of these that your clinicians use?
well, yeah, so we use ICE.
Yeah, so in your ICE request, whatever the clinician's typing, you know, patient has been dizzy for 3 weeks or whatever the investigation, within that section, you put hashtag do not automate. And essentially, when it comes back to us, we see that that hashtag and our system says, we're going to leave that one.
Right. Lovely. Thank you.
No, of course, of course. Any other questions, folks? I think it's just pricing that we've not jumped into, which we can cover.
Yeah, cool.
Right.
Let's do it. So obviously, again, 6 months free. We'll help you with all the setup, and then after that, it's slightly different because it doesn't really make as much sense with labs to do it kind of a per event. So it's a per patient on your list price. And similarly here, this is the kind of typical price, but I'll jump in a second to what it would be if everyone across the ICB was using it. And yeah, that's basically the situation. Again, it's like depends how many people are using it. There are some prices that we've agreed with Sarah and Emma that are in between this and the lowest price. So the more people, the cheaper it gets. But again, it's the same. There's no contract. It includes all text messaging. As I've already said, we'll help you set it up and train you. A couple of you have obviously already said it, but we are totally available to have additional conversations with you and your clinicians. So Brian, it sounds like 100% we should be doing that. Nikki, sounds like the next webinar we can do that. So that's cool. The price it jumps to if everyone's using it is 23p, so it changes quite dramatically. And then I'm just going to jump onto the timeline basically. So obviously at the moment, Brian, you go for it.
Sorry, I don't. I could have waited, but I just had one question. Is there like a dashboard once you're set up for like both registrations and labs?
Yeah.
Sorry, I was about to say with data.
Yeah, absolutely. It's this sort of thing. And I mean, we can do what I'm about to say for everyone, but particularly for someone like you, Bryony, who might want this, we can make particular changes on the dashboard. So you might want an aggregated view that looks at all of your practices. We can do that for registrations and labs. So it's not just, you know, how many is one practice getting, but what about the whole area. But yeah, same thing applies here with labs. You get, you know, volume, types of labs, and this we've said hub a few times. It's basically a website you log into and you manage all of our services through there. So registrations, lab reports, and newer services as well. Does that answer your question?
Great, yes, thank you.
Cool. All right. I'll do the timeline, and then obviously any more questions, please fire away. So there's the EOI that you're all thinking about or may have signed. You basically have until the 4th of September. So obviously we have another webinar between now and then. There are obviously some actions off the back of this to speak to a few of you between now and then, particularly Bryony. And then between September and October, we'll help set people up. We can basically give you lots of instruction about how to do it yourself, but also provide you with support if you're getting stuck anywhere, if you need a kind of Teams call to help you. So that's like registration setup. We're very much in the game of like letting you know what's coming and what it's going to be like, so you kind of know what the experience is going to be like. So the main thing you'll find when doing registrations is that it's relatively quick. You can do all the configuring Rumi's mentioned. The longest bit, and it's not that long, is that you just add our smart cards to your clinical system as though we're like a registration member of staff who's joining, so that we can do your registration. So that can be a little fiddly with clinical system and care identity management portal, but doesn't take too long. And then labs is shorter, quite significantly shorter because there are no smart cards.
Yeah.
It's largely about choosing the pathways and that sort of thing, isn't it? Oh, great. It says 2 on 2. That's brilliant. So
You're awake, mate.
yeah, that was just a test. But the main thing to think about at the moment is the EOI. We'll make sure that like Sarah's already done it in an email this morning, but yeah, if you need it and have lost it, then my email is here. Will has been partnering with me on the project. He's off today. I might drop in Rumi's email as well. But basically not difficult to work out our emails because it's just our name followed by the company.
Simple folks.
Yeah, I mean we maybe odd people in that we get extremely excited about this sort of thing. So love the idea of working with you, and I guess thanks for your time, and like any final questions would be happy to answer them. And I guess a particular thanks to the people who use our service already who've talked about it. Sarah, go for it.
Yeah, so we're obviously already doing registrations, like I said.
Yeah.
So could we still get a 6 months free trial with the labs, even though we're signed up? Yeah.
Yeah.
Okay.
Yeah.
Thank
Yeah.
you.
It will also, when you sign up the EOI, click for both, because you can also you're still eligible for the 6 months free registrations even though you're an existing user.
Yeah, we're giving you.
We're not like the high street banks, only for new users.
Okay, lovely. Thank you.
There are a few extra questions around there, whether you're willing to share your feedback, which you've kind of already done, and then we might just ask to see the governance you've got set up just to kind of cover our backs. But apart from that, yeah.
Okay.
Yeah. Cool. And yes, I think Sarah and Emma are well on it with the compliance and governance stuff. We're also very familiar with that sort of thing, so can help there to we have someone that leads compliance. And as I say, we're in every ICB now, so quite familiar with how to interact with each of them. Cool. I mean, Bryony, we'll pop you an email to try and nail down a time to speak soon.
I'm literally just emailing you with proposed day and time, if that's okay.
Oh, great. Perfect. And then Nikki, your clinician's coming to the next one. Was there anyone else who'd like any kind of particular like one-on-one conversations afterwards? I think registrations is really pretty self-explanatory, although I definitely can talk more about that. Labs does tend to be the one where people just want to get into the detail a bit more and, just really understand it. If there are no asks right now, it's available to you if you need it. So, yeah, thank you very much. I really appreciate it. Yeah, and Ben, thank you so much for advocating for us. I would be remiss not to say, yeah, if you're interested in the newer things we've mentioned, obviously we can talk to you about that as well, but maybe now's not the time. Cool, thank you guys. It's been a pleasure.